Hi, this is Dr. Tonya, and in today's topic, we're going to dive into the topic of what is radiation therapy. So, if you're watching this video, you've probably been diagnosed with cancer and you've been told that radiation therapy was going to be part of your journey, or you may be a friend or a loved one of someone who's getting radiation therapy and you just want to understand what radiation therapy is and what it is that they're going to be going through. So, my goal with this video really is to explain to you what radiation therapy is and how it's used as part of cancer treatment. Now, radiation therapy is commonly referred to as radiation oncology. So, when you hear the two names, it is really the same thing. Most cancer centers have a radiation oncology department. That is where you'll go to receive radiation treatments. Now, radiation has been around for over 100 years. It is a very effective tool in the fight against cancer. Two out of every three people who have cancer will have radiation treatments as part of their cancer journey. So it's a very common part of cancer treatments. Now, how is radiation therapy used? Radiation therapy is used primarily in one of two ways. It's either used to cure cancer, so to actually shrink cancer and make it go away, any cancer that hasn't spread, or to treat any microscopic cancer cells that may still be in the area after the cancer has either been removed with surgery or shrunk with chemotherapy. Radiation is also used in what we call palliation to reduce symptoms. So, in people where the cancer cannot be cured, radiation can be used to reduce symptoms of pain. It can help you breathe better if the cancer may be blocking off one of your airways, or it can also be used to stop bleeding. So, radiation can be used to help you feel better if it can't, actually, in addition to helping to cure the cancer. So, what is radiation therapy used? So, when you're initially evaluated, your care team will recommend when radiation would be most appropriate for your particular situation. And radiation can be used in multiple ways. One way, it can be the only thing that you need to cure your cancer. So sometimes radiation is the only treatment that you need. Radiation can also be used before surgery to shrink the cancer so that when surgery is done, that all of the cancer can be removed safely. Radiation can also be used after surgery to stop any microscopic cancer cells that may still be there from growing. We call this type of radiation adjuvant radiation. And radiation can also be used along with other treatments like chemotherapy or immunotherapy or even hormones. And we call this type of radiation therapy concurrent treatment, where it's given along with another therapy. Now, you may be wondering to yourself, okay, well, what exactly is radiation? Well, radiation is intense beams of energy that come from a source that travels through space, and it's used to kill cancer cells. Now, most people have had low energy radiation. Low energy radiation is used for imaging. So, if you've had an x ray or if you've had a CAT scan to take pictures of your body, that type of radiation is low energy radiation. Now, high energy radiation is used to treat cancer. We call this therapeutic radiation. And therapeutic radiation is delivered with photons from a machine called a linear accelerator. Now, another type of external beam radiation is done with a different particle of radiation. It's done with something called a proton. And protons are delivered with a machine called a cyclotron. So your care team may recommend protons for the type of external beam radiation therapy that will be used for your treatment. So, how does radiation work exactly? Radiation works by injuring cancer cells and stopping them from growing. When those damaged cells are destroyed by the radiation, then your body, your immune system actually naturally eliminates them from the body. Now, you may be asking yourself, doesn't radiation hurt normal cells too? Well, yes, it does. But the good thing about the way our bodies is made is that normal cells can actually heal the damage caused by radiation treatments, whereas most cancer cells can't. So, as long as you don't receive a dose of radiation that is large enough to permanently injure the normal cell, that normal cell can actually heal itself in between each of the radiation treatments. Now, radiation treatments have come a long way. From the early 1950s, we treated with a machine called a cobalt unit, where there was only one radiation energy. So it didn't matter what part of the body was being treated, it was all treated with this one energy. So you saw a lot of toxicity, a lot of burning, and a lot of side effects from radiation. But over the years, the technology with radiation treatments has advanced tremendously. And when I started my radiation therapy career, we were using a machine called a linear accelerator. And this linear accelerator had multiple different energy levels. So the side effects were significantly reduced from what you would used to see with that cobalt 60 unit. So we saw fewer side effects in the last 30 years. And now linear accelerators have gotten better and better. And our modern linear accelerators, not only are they more accurate because we can actually take pictures to make sure that we're targeting accurately before we treat, but these machines have multiple energies, multiple types of radiation, so that the treatments can be more accurate, more concise, and safer with much less side effects and toxicity than treatments back in the past. So, if you've heard lots of stories about people who had a lot of side effects from radiation, lots of burns, we typically don't see those types of reactions anymore because the machines are so much better. So, in this next video, I'm going to introduce you to the radiation team that you're going to be working with when you come to get your treatment. So if you found this video helpful, please like this video, subscribe to this channel so that you'll be notified as soon as a new video drops. And also, if you know someone who needs this information, please share this video with them as well. I'll see you guys in the next video.